shoulder joint mobilization, also called as GH joint, glenohumeral joint mobilization. Type of the joint is synovial. Variety, ball and socket variety. Atlas surface, glenoid cavity of the scapula. So this is the glenoid cavity of the scapula, and head of the humerus. Here we will be having head of the humerus. This is our head of the humerus. So atlas surface, glenoid cavity is concave. Head of the humerus is convex. Arthrokinematics. So here we will be having movements. Shoulder and movements will have flexion, extension, abduction, adduction, IR, ER, internal rotation and external rotation. So these are the movements. So to get flexion we need posterior gliding. To get extension we need anti-gliding, abduction, inferior glide, adduction, superior gliding. Concave convex rule. So according to this concave convex rule, to get flexion we need posterior gliding. Mostly we will apply this mobilization in frozen shoulder patients, rotator cuff injuries, any joint stiffness, that cases we will apply. So here this is our shoulder joint, humerus and glenoid cavity. This is the articulation. This is our shoulder joint. Whatever we are going to do movement here, so here we are going to move the humerus on the glenoid fossa. So to do mobilization, first we have to give distraction to the joint. So how we will give distraction? We are going to flex the elbow joint, then we will hold like this. See, here I am stabilizing this joint. Here I hold lower end of the humerus. Then like this distraction force I can give to the joint. Distraction force I can give to the joint. Now we will see posterior glide. Before giving posterior glide, we have to stabilize the scapula. Just lift your body. So we have to stabilize the scapula with towel. Then we are going to give mobilization. How to give mobilization? We can give in long lever and short lever also. Here we are going with short lever. So here I am stabilizing the wrist joint, and here I am stabilizing the wrist joint and elbow joint. Here I stabilize. Then little I will give traction force. Then here we are going to apply straight hand, not like diagonal, like straight hand. Here I am feeling head of the humerus. Then here we will give posterior glide. This is the way we can give posterior glide to the shoulder joint. It is going to improve the shoulder flexion. The progression of the posterior glide. Posterior glide how we will give is the way we have to give posterior glide. Like this is the way progression. We are going to keep the shoulder like this, and here I am keeping like this. Then here we can give posterior glide progression. That's it. Anterior glide is going to helpful for the shoulder extension. So here we can keep patient hand like this. Here we can keep like this. Then we can give traction. We can apply anterior glide over the humerus head. Otherwise, one more option. Here we can stabilize like this. We can give traction. Then we will apply anterior glide to the shoulder joint. So it is going to improve the extension range of the shoulder joint. Now we are going to do progression for the inferior glide. Usually inferior glide. So this is the position how we can give. This is the position we can give inferior glide to the patient. This is the initial. As a progression, we will take it up to 90 degree. After 90 degree, again we are going to apply same inferior glide to the patient. Are you listening that sound? This progression, and one more method of progression. Take the patient hand up to 90 degrees. Flex your elbow. Like this we take. Here we are going to keep our hand over the head of the humerus. Then we are going to give inferior glide. This is the progression of the inferior glide.